a neoplasia syndrome in which multiple endocrine glands are involved. That's why we call it multiple endocrine neoplasia, not just one tumor. You can say a set of more than one endocrine gland tumors are seen in a specific pattern. So we call these MEN syndromes. MEN syndrome is MEN 1 or MEN 2, and there is another variety, MEN 4 is now introduced also. MEN 3 was also there, which has now been merged in the MEN 1. MEN 1 is because of the mutation in the menin 1 gene located on the chromosome 11q. MEN 2 is because of the gene located on 10q, and MEN 4 is due to mutation in the CDKN1B located on the chromosome 12p. Now, what is MEN 1, what is MEN 2, and what is MEN 4? I'll go into the detail of it. We have MEN 1. Keep it in mind, MEN 1 is 3 Ps. Just to keep you, make it easy for understanding. MEN 1 tumor has 3 Ps. These 3 Ps are the tumors of the pituitary gland, the pituitary adenoma, parathyroid hyperplasia, and pancreatic tumor. So 3 endocrine glands are affected in MEN 1 syndrome. Pituitary gland, parathyroid gland, and the pancreatic glands. So we have pituitary adenomas, parathyroid tumors or the parathyroid hyperplasias, and pancreatic tumors. This is called MEN 1 syndrome. Patient may present to you with features of parathyroid overactivity or pancreatic tumors, symptoms because of the pancreatic tumors, or symptoms of the pituitary adenomas. In MEN 2, we have MEN 2A and MEN 2B. In MEN 2A, we have parathyroid hyperplasia, just like MEN 1. With this, in the vicinity, we have a medullary thyroid cancer, and we have a pheochromocytoma. What is a pheochromocytoma? What is a pheochromocytoma? Anyone has heard it before, pheochromocytoma? What is pheochromocytoma? Level 12, you don't know what is pheochromocytoma? Anyone?
It's in the suprarenal gland tumor. I think, yeah.
What what it produces?
Sorry.
It's okay. What pheochromocytoma produces?
A lot of hormones that's in the suprarenal glands, and they just come, and the high blood pressure.
How many lots?
Also,
what are the actual secretion of this pheochromocytoma? Pheochromocytoma, it secretes which gland, which hormone, or which secretions? Pheochromocytoma secretes catecholamines. Yes, there are other things that are also secreted by this adrenal gland, but pheochromocytoma is a catecholamine releasing tumor. They arise from the chromaffin cells. Okay, and when it is secreting catecholamines, think what it will cause. Patient will have tachycardia, like I was saying yesterday, pheochromocytoma in palpitations, because it will cause tachycardia and high blood pressure, because catecholamines are more. So it not only causes tachycardia, but it also causes hypertension. Patient with severe hypertension, headache, and tachycardia. This is you can say these are the classical things that you will get in a patient with pheochromocytoma. Now, a patient presenting to you with palpitations, headache, hypertension, and a neck mass, what it could be? It could be a MEN 2 syndrome. Okay, because
MEN 2 syndrome or pheochromocytoma, doctor, because it's the same signs and symptoms.
Sorry.
The same headache, hypertension, sweating. It's the mental syndrome or pheochromocytoma. It's the same symptoms.
Yes, I'm saying a patient presents to you with these symptoms and a neck mass. Think about MEN2 syndrome. Okay, because MEN2 syndrome is the symptoms of pheochromocytoma, and with that there may be either there is medullary thyroid carcinoma or a parathyroid hyperplasia. So patient presenting to you with a neck mass with symptoms of pheochromocytoma, it is a MEN2 syndrome, because more than one gland is involved here. There is a parafollicular cell tumor, medullary thyroid carcinoma, or there may be a parathyroid tumor, parathyroid hyperplasia, or there may be pheochromocytoma. So in men 2A and men 2B, two things are same in men 2A and men 2B. In men 2, there will be pheochromocytoma and there will be medullary thyroid carcinoma. The parathyroid, if it is involved, it's called men 2A syndrome. If instead of parathyroid we have neuromas in the mucosal cavity, in the oral cavity we have mucosal neuromas, or the patient has Marfanite body habitus. Marfanite body habitus means Marfan syndrome. What is Marfan syndrome? The patient is like I can say a giant. If the patient is having Marfanite body habitus, he is having he's tall and having heavy body, heavy and strong, tall body, like the patients of the Marfan syndrome, and they have mucosal neuromas. This is meant to be. So pheo with medullary thyroid with 2M, we call it we call it MMMP. If it is MMMP, it is meant to be. If it is MPM, if it is MPM, we call it meant to A. Triple P is for men 1, PPM is for M2A, and P triple M is for men to be. So you have to revise it by any means. I have my own mnemonic for it. Make your own mnemonic or use this mnemonic that are been given here. 3 P's, 1 M, 2 P's, 2 M, 1 P's. Usually for men to be, we have 3 M's and 1 P. That's not 2 M, 1 P's. It is 3 M and 1 P. MTC, Marfanite habitus, mucosal neuromas, and pheochromocytoma. These are the different endocrine gland involved in a same in the patient, and when they are involved like this, we call the patient is suffering from MEN syndrome. Okay. Inshallah, I'll give a question about it in your tutorial, and when you will read it further, it will be more clear to you, inshallah, how the patient presents and how you can label it as MEN 1 or MEN 2 or MEN 2A or B syndrome. Okay. For MEN 1, it's also called Werner syndrome. Its mnemonic is 3 P's: parathyroid, pancreatic, and pituitary. Okay. In pancreatic islet cell tumor, we may have insulinomas. Patient may have the finite symptoms of the insulin producing tumor, or they may have the symptoms of the Zollinger-Ellison syndrome, the gastrin secreting tumor. Patient presents with refractory peptic ulcer disease. So a patient with refractory peptic ulcer disease with a pituitary tumor or a parathyroid tumor or parathyroid enlargement. Symptoms of parathyroid enlargement are affecting the bones and the calcium metabolism. If the patient is having symptom combination of these things, we label it as a MEN 1 syndrome. MEN 2, we already said that these are associated with pheochromocytoma and the calcitonin releasing medullary carcinoma of the thyroid, and these are in MEN 2. The rest, we have either MEN 2A having parathyroid hyperplasia or hyperparathyroidism, or we have M2B in which we have mucosal neuromas and Marfanite habitus. MEN 4, which I said you before, MEN 4 checkers due to mutation in the CDKN1B is usually indistinguishable from MEN 1 syndrome. In addition to the same things which we have in MEN 1 syndrome, the triple P, They are having additional things like reproductive organ tumors, like testicular tumors or cervical cancers, neuroendocrine cervical cancers, or they may have adrenal and renal tumors. Now, this is all about the Men's syndrome. How they usually present. Treatment is according to the patient's presentation, and it depends on which patient is presenting with what symptoms and which tumor we can manage or we can treat. Any question about it, about the Men's syndrome? It's over. The lecture is over. Any question?
No, thank you, Doctor.
Okay, you all have marked your attendance on the Moodle. For 20, there were 30 attendances. Now for 30, I think all 46 have marked their attendance. Finished, khalas? Can I close it?
Thank you, Doctora.
Okay, inshallah, today by 5 o'clock, I will send you the scenarios, but you have a progress test tomorrow. Can you tell me at what time you will be available to discuss that tutorial? Ms. Muhammad Hussain here. Muhammad Hussain Zankarani is here. He's not here. Anyone can discuss it with him and yes.
Doctor, I have the same problem with the attendance. Still, they told me the service is out.
I mark your attendance. It's okay.
Okay, Doctor.
Okay, I will send a message on WhatsApp. Tomorrow you have a progress test, so you are not available in the morning. I'm not sure what is the timing of your exam. So can you come up with consensus time that you can give to me for the tutorials? Anytime tomorrow or the day after tomorrow, whenever you are free. Okay, I will drop a message on WhatsApp. Discuss it among yourselves and come up with some timing, about 2 hours or 3 hours, whatever is feasible for you. Okay, assalamu alaikum warahmatullah. If there is anything you need to get clear, you can send a message on WhatsApp. Okay.
Inshallah. Thank you, Doctor.
Okay, assalamu alaikum.